We've just finished adult 1 month, 2 month CPR was the use of AED. So now, we'll start our discussion for children 1 year old to puberty and infant CPR. Remember that there are many similarities between adult and children CPR. The only changes that we have is the depth of compression, of which for adult we say it is 2 inches or 5 centimeter depth. For children, it is 4 to 5 centimeter depth. It is depends to the body size of the children. There are children who are 12 years at age. However, their body size is like equivalent to 7-year-old or 8-year-old. At some point, there are children who are 12 years old or below puberty age, but their body is already similar as the size of an adult. So that's why, with consideration to the size or body size of the children, you need to identify the depth of compression when you do CPR. Another changes with regards to children CPR compared to adult, if you identify a witness or unwitnessed collapse, you can first call EMS and activate emergency medical services and call for assistance, or leave the patient and call for help. However, for child, it is very important that you start first with chest compression for 5 cycles, and then that's the time that you can call for help. As what I have said earlier, cardiac arrest is not common for children. They usually suffer from respiratory arrest. In the case of child witness collapse, in front of you the child becomes unresponsive, you can call first for help or ask somebody to call for help and activate emergency medical services and bring AED. Now let us see how we'll do the child CPR.
You arrive on the scene. Check the scene for safety. Check the child for consciousness. Gently tap the shoulder and shout.
Are you okay? Are you okay?
If no response, call 911 immediately.
You, call 911.
If the child is lying on their stomach, turn them over onto their back. They should be lying on a hard, flat surface. Check for breathing and signs of life. Watch their chest for any normal movement. Look for signs of life and breathing for no more than 10 seconds. No breathing or signs of life, begin CPR. Position the heel of one hand on the center of the child's chest. Place your other hand on top. With your elbows locked and arms straight, lean over the child's chest and compress the chest 2 inches in depth 30 times.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After 30 compressions, give breaths. Give breaths by tilting the head back, lifting the chin, and pinching the nose. Place your mouth over theirs and give 2 slow, gentle breaths, just enough to make their chest rise. Continue with 30 compressions and 2 breaths.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Continue CPR until you see signs of life, another rescuer takes over, or help arrives.
Another consideration with regards to children's CPR, you can use both hands in doing chest compression. However, if the child is too small, you can use the heel only of your one hand and other hand over the forehead of the child to maintain open airway. Now let's just proceed with infant CPR from 0 to 12 months old. Both CPR for children and infants are the same. And however, the difference is that, like what I've said, For adult and children, you can check for carotid pulse. Always check the pulse closest to you. For infant, we check their brachial pulse. Okay, you just slightly run your four fingers along or under the armpit of an infant, and then from there you can find the brachial pulse. That is one of the difference between children and adult as well as infant. The other difference for child and infant is that if it is a single rescuer, we use only two fingers when we do chest compression. If there are two rescuer, what we do is that we encircle our hand over the chest of the infant and we use our two thumbs to do the compression. If you can see, this is the way how you will going to check the pulse of an infant. This is the brachial pulse. Always check also the pulse closest to you. If you are alone doing chest compression or CPR for an infant, you need to use only your two fingers. Whatever you are comfortable with. You can use your index finger and the middle finger, or your middle finger and the ring finger. If there are two rescuer available in the scene, one of the rescuer will maintain the airway open, and the other one who do compression, he or she should encircle her finger over the chest, or his hand over the chest of the infant, and using his two thumbs for compression. You should compress 1/3 of the chest depth for most infant for about 1.5 inches or 4 centimeter. It is similar to the child. If you are only person available on the scene, you need to first do 5 cycles of CPR, and then after that, that's the time that you can call for help. Because infant is primarily not suffering from cardiac arrest. The most common cause of their death is ventilation or respiratory arrest. If you witness a collapse of an infant in front of you, you can ask somebody to call for help and activate emergency medical services and bring AED. And then that's the time that you can proceed chest compression or CPR. Let us see the CPR for infant.
If the scene is safe, approach the victim and assess their responsiveness. Send another person to activate the emergency response system and get an AED if possible. Assess breathing and check the infant's pulse. If the infant is not breathing or only gasping and you can't find a pulse, begin CPR starting with compressions. Perform 30 compressions at a rate of 100 to 120 compressions per minute at a depth of at least 1/3 the chest. For infants, this is about 1.5 inches. When the AED is brought to scene, begin by turning the device on. Remove any clothing from the victim and apply the AED pads, one on the front of the infant's chest and one on their back. Plug in the connector and clear the victim while the AED analyzes the rhythm. If no shock is advised, resume CPR beginning with chest compressions. If a shock is advised, clear the victim again before delivering the shock. Once the AED has charged, hit the shock button. After delivering the shock, resume CPR beginning with 30 chest compressions. Open the airway and deliver 2 breaths, each lasting 1 second. Watch for chest rise. Begin again with 30 chest compressions and continue at this ratio of 30 compressions to 2 breaths until the AED prompts you to stop or further help arrives.
That is your 1-man CPR for infant. Let us see 2-man CPR for infant.
If the scene is safe, approach the victim and assess their responsiveness. Send the other person to activate the emergency response system and get an AED. Assess breathing and check the brachial pulse. If the victim is not breathing or only gasping and has no pulse, begin CPR starting with compressions. Perform 30 compressions at a rate of 100 to 120 compressions per minute at a depth of at least 1/3 the chest. For infants, this is about 1.5 inches. Open the airway and deliver 2 breaths, each lasting 1 second, and watch for chest rise. Resume compressions. When the AED is brought to scene, the second rescuer should begin by turning the device on. Remove any clothing from the victim and apply the AED pads, one on the front of the infant's chest and one on their back, while the other rescuer continues performing CPR. Plug in the connector and clear the victim while the AED analyzes the rhythm. If a shock is advised, clear the victim again before delivering the shock. Once the AED has charged, hit the shock button. After delivering the shock, resume CPR, begin 15 compressions using the encircling hand technique. After the compressions, the second rescuer opens the airway and delivers 2 breaths. Continue CPR at this ratio of 15 compressions to 2 breaths until the AED prompts you to stop or further help arrives. The rescuer should switch roles every 2 minutes or after about 5 cycles of CPR.
That is also the other difference between the adult and infant CPR, or even for child. For infant CPR, if there are 2 rescuers, you need to provide 15 compression and 2 ventilation. If you're a single rescuer, you maintain 30 compression and 2 ventilation. Now, that concludes your child 1 year to puberty and infant CPR.